Teenager has been awarded a lifelong medicinal cannabis prescription on the NHS in a landmark decision that could pave the way for thousands more patients to receive the treatment. The decision has been signed off by doctors and officials following years of campaigning by the teenager's mum, Charlotte Caldwell, from County Tyrone in Northern Ireland. Billy Caldwell's first batch of medicine under the new agreement, prescribed by a private doctor but funded by the health service, will arrive on the 1st of November, exactly 2 years after the law was changed, legalising medicinal cannabis in the UK. Let's talk now to Dr. Michael Södergren, who is Managing Director at Sapphire Medical Clinic and NHS Consultant Surgeon at Imperial College, and also Charlotte Caldwell and her son Billy. Welcome all of you. Thank you very much for talking to us. Charlotte, first of all, how do you react to this?
Well, obviously, good morning,
Good morning.
Victoria, and thank you for having me. Obviously, we are, ecstatic. We're over the moon about this. I received the news, obviously, that we've been waiting for this last 2 years. Billy's GP called to say would I come to the surgery to discuss the new shared care plan that his medical team had developed. The care plan is the first NHS package that's ever been developed like this, and it will allow Billy to receive his medical cannabis under the NHS. I have to say I'm incredibly grateful to the health authorities in Northern Ireland who have worked relentlessly with Billy's medical team to develop and make this happen. And I want to further commend Matt Hancock for creating a refractory epilepsy advisory specialist clinic expert panel at Great Ormond Street. This has allowed Billy to actually avail of this new care package. Billy was referred to the RESCAS expert panel, sorry guys,
right,
in July of this year, and he fortunately for Billy, he got a positive outcome. And a huge thank you obviously has to go to Robin Swan, our health minister here in Northern Ireland, who has honoured his personal commitment to actually ensure that Billy receives his care plan.
Yeah. Before I bring Michael in, Dr. Södergren in, can I ask you how important this cannabis prescription is to the quality of Billy's life?
It actually means everything to Billy. This is the medicine that has kept him alive for the last 4 years. Billy has had access to medical cannabis via a private prescription for, it's like I said, it's 4 years, which is an incredibly long time. And it is controlling his life-threatening seizures.
Dr. Södergren, how big a deal is this, would you say?
Good morning. Well, I think there's no doubt that this is very significant indeed, for a couple of reasons. I think primarily, really most importantly, at the heart of this is a young man who we know benefits significantly from this medicine and in some ways can be described as life-saving. And he's now able to access that medicine on the NHS. But on a wider note, this is the first time that the mechanism that's been set up by the NHS to evaluate these cases that don't fall within the NICE guidelines and to evaluate them as to whether they can be prescribed medical cannabis on the NHS. And so this is significant in so much as this highlights that the route towards a medical cannabis prescription outside of NICE guidance is possible in the NHS. In this case, for severe refractory childhood epilepsy, but maybe over the next months and years, that will be opened up to other conditions where these medicines have got really life-changing consequences.
Well, that is really interesting, because so the consequences for other patients and for other kinds of treatments, you're saying?
Yes. So, I mean, the issue is that medical cannabis was legalized for prescription a couple of years ago, and we're really trying to fill the evidence gap as a medical profession. And there is no doubt that the long-term route is through evaluation by NICE, like we do with all other medicines, but that's going to take some time. And in the meantime, there is also no doubt that we should make special provisions for particular groups of patients like Billy and others who need this type of treatment. As a medical profession, we build up the evidence base. And so this is strictly necessary, but hand in hand with this, we need an approach, a medical approach, to build up the evidence base, not just randomized controlled trials, but also, like we've been working on at Sapphire clinics, a real world evidence base that can be used to support how this treatment changes symptoms, how that relates to the quality of a patient's life, etc.
Charlotte, briefly and finally, your campaigning, which has been immense, it could potentially benefit many other patients. How do you feel about that?
Yeah, absolutely. Like, even today, talking to you, Victoria, you know, I'm also thinking of the large groups of patients that I support on a daily basis. We have patients with MS, ADHD, epilepsy, chronic pain. And, you know, you know, there's thousands. There's actually 1.4 million patients in the UK with a wide spectrum of conditions treating themselves of the black market with medical cannabis, treating their medical conditions. You know, these patients are still being denied access. So, you know, I have committed myself the last number of years, and I continue to commit myself to continue to do all I can to process the access for these desperately ill patients, and work as closely as possible with the likes of Dr. Snorgan at the Sapphire clinic to try and get more clinical research. So as these patients, you know, can avail of the same medicine that is basically saving Billy's life.
Yeah. Well, thank you both of you for talking to us today. We really appreciate it, and we wish you all the best. Thank you very much.
Thank you.